Welcome to Adapting Place. There's some pharmacology that sometimes they can be very confusing. They are usually cough medications, respiratory medications. It's difficult to figure out what they are and how to use them. This video is designed to make it easy for you, straightforward, not beating about the bush, giving you the facts, and you'll be able to distinguish them when you see them in the question. So let's get to it. As usual, like I said, straightforward. We're going to go through some of these medications, very short lecture. There's a group of them. The first group is antitussive. Basically, that's what it is, a cough. Tussives are what we call coughs. And what does that mean? If it's anti, it means it suppress cough. That's all. That's the first group. How did they do that? We use it because of cough. There's certain coughs you have to worry about. They are dry, non-productive, right? Non-productive cough. Those are the one you can suppress. It's dry, non-productive. If it's productive, you got to figure out some way. So dry, non-productive cough, you use antitussives, right? It suppresses um, the cough reflex in your brain. So that's the main thing that they do. You have to know an example because when they give you a question based on what the patient is doing, if they are having dry, non-productive cough, your best bet is dextromethorphan. This is the number one um, medication that you see it in antitussives. It's non-opioid, so it's non-sedative, right? It's non-opioids. Um, and then it acts in your brain to suppresses your cough. There is a codeine, which is opiate derivative. So these are opiate, right? Those are um, they are opiate antitussive, right? Therefore, you can see since they are opiate, they can give you what? They can suppress your respiratory drive. So respiratory depression, and then they can also give you the very sedative. So you got to watch carefully in kids. The next one is you have to know, remember, this can be very confusing. Benzonates. They are the benzonatates, right? Benzonatates. They are not like the codeine and dexamethasone, but they're different. All they do is they numb the stretch receptors in your throat respiratory system, right? It's very, very important. These guys, they stretch receptors, they numb it like lozenges, right? We take lozenges to help us like that in the respiratory tract. Um, the reason why they're very important, you don't chew. So do not chew. Otherwise, it will cause this airway obstruction. So the best thing is to suck on it. Don't chew. So benzonatate, they are like lozenges, but they also help. They are antitussives to decrease your cough. And then what they do is they numbing the respiratory tract, and so you don't have to chew it. Otherwise, they don't do the function they're supposed to do. These are antitussive. That means to prevent you from coughing, and the cough has to be non-productive. Very, very important. The next group is expectorants. Based on the name, they're trying to get rid of something. So this is the key about this cough medications. Based on the name, you can figure out expectorants. They're trying to get rid of it. All they're doing is they thin your mucosa. The mucus, if it's thick, it will thin it out. And it's used for what? Used for productive cough. They're going to make it very thin, right? And they help you clear your secretion. You clear the mucus. So just make sure you understand that key concept related to these specific medication. And you've seen one before. They make your mucus very thin and help you clear it. everybody knows guaifenesin. That's number one. It's the number one type of expectorant to get rid of it. The other name, if you remember, is Miscellaneous. This is exactly what it is. It's going to increase respiratory tract secretion. So it make you thin, but remember, it's going to increase the secretion so that you can clear it because it's making it thin and you get a lot of it. All right. You have to help it by drinking a lot of water. Hydration. This one you got to drink. This will maximize the effectiveness of the medication. As you drink, you make the mucus very thin. You may have more secretion, but that is the only way it can get rid of it. So that's that one. Guaifenesin. The next group is called mucolytic. They are not the same, mucolytics. They break it down. There's different breakdown of mucus. There's different strategy involved. One, I thin it and I make it liquidy and it become a lot. You have a lot of it and you get rid of it. It's very thin. There's another one, you break it into pieces. That's the mucolytic, right? And they use it for thick. If the secretion is very, very thick mucus, right? It's not thin mucus. Like expectorant is very thin mucus, and they make it smaller, but in thickness, but a lot of it. Mucolytic break it thick mucus, especially somebody with the COPD or cystic fibrosis. This is what we use it for. 60, it make the mucus, you use it to break it down. Um, key example is acetylcysteine. That's another name for mucumist, right? Most people call it, this is the right name, but they can give you this mucumist as an example. But if you see acetylcysteine, it's the same thing. Um, all he's going to do is breaking down the mucus in the process. If it's thick, it liquefies it. It liquefies the mucus, and then you get rid of it. The biggest problem is it can cause bronchospasm, especially in asthma patient. So you got to be careful. If your asthma patients do not take mucolytic because asthma does not have secretion. If you give them mucolytic, now they have a lot of secretion. They're breaking down the secretion and you're going to irritate their airway and it causes bronchospasm. These are the group of um, cough medications supposed to know. Antitussives, expectorant, and mucolytic. These are the three main group. Unfortunately, there are other ones that can be used as you can use them as basically cough suppressant or and then they can play a role. So I will classify them as miscellaneous, right? So these are miscellaneous um, medications. And you can see questions related to that, but you have to know how to apply it. Decongestants. Decongestant, they are not designed to be cough medications, but they can play a role for cough in treatment of cough. And it's used sometimes for cough, right? It's used sometimes for cough. Example is Sudafed. So these are pseudoephedrine. These can be used as a cough suppressant. What it does is it reduces nasal, right? The nasal congestion. That's why we call it decongestant, the nasal congestion. It reduces the congestion of your nose, and that prevents the cough that will happen, especially if you have post-nasal drip. Remember, you should avoid in patients who have hypertension or glaucoma. It worsen the disease process. So that's all I'm going to say about those groups. They are miscellaneous group. Next group is antihistamines. They are also can be used for cough, but mostly for post-nasal drips. When you have a lot of secretion go back of your throat and they go into your airway, irritate you, and you start coughing. So we can use them. Example, antihistamine is diphenhydramine. That's one of them. They are H2 blockers, right? They are loratadine. This is another example, and cetirizine. These are all H2 blockers, antihistamines that you can use to help with that. Remember, they will dry up your secretion, right? They dry up secretion. They are like decongestant. They will dry it up, and you can also use it for if the patient have allergic cough, you coughing because of allergies. Because they are antihistamine, they have anticholinergic side effects. So don't forget, this is key. Drowsiness and dry mouth. Patient will be complaining about it. So those are common side effects you may see. Okay. You may have a question about bronchodilators. Bronchodilators can also be used as a cough-related medication. How? If the cough is due to what? Airway, right? It's due to the airway issue. So cough from the airway. Sometimes you have airway irritation and you may cough or obstruction or something like that. And you already know albuterol or ipratropium or maybe theophylline. These are um, bronchodilators in the respiratory system. And you can use it if the patient is cough because of airway obstruction. And then so it's good for asthma patient or COPD patient. So that's what we can use it for. Okay. So those are the things you have to know. Why would somebody with we use bronchodilators or airway issue have a cough? If the bronchospasm, they have bronchospasm. You remember, asthma patient can cough when they come in. Yeah, bronchospasm can create the cough, and that will become a problem. The last group is steroids. Once again, they are not true cough medication, but there's certain situation you can use them, right? Some people cough because they have chronic inflammation. So watch the question, then they ask you, if I'm coughing because of chronic inflammation, you cannot give me the dextromethorphan, right? You have to give him steroid that can deal with the inflammation. An example is fluticasone or prednisone. These are few medications that you can use if cough is due to steroid. Lastly, this is NCLEX content right here. This is I don't want you to forget this. This is lastly, if they ask you a question, this is what you do. If the cough is productive, okay, do not suppress it, okay, unless there's other prescription. So if the patient is coughing, don't suppress their cough. Let them cough unless the doctor ordered it, right? If you need to give a expectorant, you got to make sure, right? Expectorant, you have to make sure the patient is no asthma, that has no asthma, otherwise it will cause bronchospasm, right? If you're giving somebody muculated, make sure they're drinking a lot of water, like fluid, right? To help with that. Um, if patient has hypertension and glaucoma, yeah, avoid decongestant, right? You got to avoid them because otherwise they make them their condition worse. So if patient comes in, the blood pressure is well controlled, all of the time his blood pressure is high, make sure he's not taking decongestant. Right. And the last one is codeine. Because of the sedative effect, you got to make sure it causes sedation and respiratory depression. So these are medications you should know and be comfortable with respiratory pharmacology in terms of cough medication. Antitussive, expectorant and mucolytic. And then there's miscellaneous guys, which are decongestant, antihistamine, bronchodilators, and steroid. Thank you very much. Respiratory pharmacology must know. Have a good day.